Hello, everyone, and I'm very happy and I have the honor to introduce you to Dr. Smriti Gupta. She is the proud Damsonian and she's secured an amazing rank 65 in PGI and she has an OBC rank 10, which is awesome. So, heartiest congratulations, Smriti.
Thank you so much, ma'am.
And Smriti has been a consistent performer. She did do well in AIMS exam as well. She secured a rank 153. And what is good about this is that, she's done all this with her internship itself. Yes? So, shows your consistency, dedication, and your hard work. So, once again, heartiest congratulations.
Thanks a lot, ma'am.
And Smriti, you are here to share your strategy on to how you managed to do well in all the Central Institute exams, and we are hoping for best for JIPMER as well, with our fingers crossed, right? So let's begin with Smriti. You started with us as a foundation student in your third prof itself.
Yes, ma'am.
And in the internship, you've done a test and discussion course. So I really want to know how you utilized the material. A, to plan your study. B, how did you manage with the schedule? And then we will talk about revision gradually.
Ma'am, the coaching started in the third year itself.
Mm-hmm.
So the starting was like you are making your own notes.
Right.
So everything is in your handwriting, and what faculty speaks over there doesn't write everything on the board, and what we get notes is like it's your own made, and you add your point, what you understand from the classes.
That's something very interesting, because faculty would use a lot of clinical case scenarios and things like that to put across things. So what you understand from the class, I would say 80% of teaching happens in the class itself, right?
Yes, ma'am. And for the TND, the schedule was just a way to channelize your energy.
Okay.
Ki, what plan you are making in your internship.
Right.
Like every week I had to give a test.
Right.
So I, rather than making my own schedule, I had already a schedule being given. So I had just to follow it, that you have to read that subject in particular that week.
Yes, I think it is. Do you think it is important, because when you are left by yourself, half of the time you don't know what to start with and how to start with.
Yes,
and even if you start somewhere in the middle, you start slacking behind.
Ma'am, initially my postings are very light, so I used to cover the subjects which were given in the TND topics and everything.
Okay.
But after September, it was like TND was over in the August, and in September I was started with the medicine posting.
Okay.
So I was left with like where to start from revision. I don't have the schedule to follow. I have to make my own schedule.
Right.
So that was, then I realized ki how much useful the TND schedule was for me to push me forward.
That's true. So, the reason I was asking is because a lot of students have this query itself, that should they make their own schedule or should they follow the schedule that is given as a part of the course itself?
Ma'am, I will recommend to follow the schedule which is given already. We have to
Right.
utilize all the material we have been given. That is more than enough for the every preparation we are doing.
Right. And now you will, can you elaborate on how exactly did you prepare for a test? You are given a week after which you have to appear for the test and there's a discussion following it. So how did you utilize this week and what exactly were you studying then?
Ma'am, since with internship, I don't think that we have so much of time to study, or so I stick to my notes. I
Okay.
used to revise the notes, and a day or two before, when I used to see ki there are, if I am able to cover the notes, I used to practice some amount of MCQs.
Okay.
And if not possible, only I used to give the read only notes
Right.
and give the test.
Yes.
And when sometimes I was not even prepared for the test, but still I used to give the test. At least I will attempt the paper and learn something out of it.
That's a wonderful advice. A lot of times you're not really giving a paper of the fear of what will happen if you're not well prepared. But as she said, every test is an opportunity to learn, and that's what she thought it as, that she'll learn something by giving the exam, which is, I think, a wonderful mind frame, which is what is required for these competitive exams, right? You have to have the courage to face it and challenge your brain, because sometimes you feel ऐसा लगता है कि हम भूल गए हैं, पर जब हम कोशिश करते हैं to rule out from your basic knowledge, you are able to revise and recall the things.
Yes, ma'am.
Right. And बच्चे when you started with the foundation course and then when you do the test and discussion, there would be some updates because medical science keeps evolving.
Yes,
So do
ma'am.
you think that the discussion was good enough to give you what was required as for these competitive exams?
Yes, ma'am. In fact, we started our coaching in our third year, and since we are giving paper after 2 years,
Yes,
and in the recent years, the pattern of the paper, many papers have changed.
that's true.
So we cannot rely on the old facts what we read in first year, second year on our own. Obviously, we
Yes.
need to get updated. And if somebody give us update, that is more helpful than we are searching for updates everywhere.
That's true because it takes a lot of time. Right. And बच्चे टेस्ट के बाद आके did you do a strength weakness analysis? Did you make some copy where you could note down your which topics are weak or you would want to go back to those topics or something like that?
Ma'am, not possible after all the tests.
Okay.
But few subjects like biochem and pathology, and where my subjects are weak, I used to make that these topics I have to revise in the last month for sure.
Okay.
That I will tend to forget these topics. So
Right. So you had a list of volatile topics.
volatile
Okay,
topics,
that's
and
great.
the strengths like clinical subjects are things we used to retain more than
Because you have done them recently only.
yeah, the
Yes.
final year subjects we have done recently in a
That's
great strength. So we used to, I used for the strength and
Yeah, that's wonderful. So you had a list that you would refer to later on. Okay, and Smriti, I would want to ask you, did you try and give the grand tests?
yes, ma'am. Actually, when I was revising during September, I was revising like if I revise one subject, if I limit to my MCQs to that one subject, then the all other 18 subjects will get washed off from my mind.
That's true.
So grand test used to keep me in touch to the all other subjects simultaneously.
Yes, that's a very good piece of advice again. You know, it acts like a passive revision for all other subjects. एक तो है जो आप actively पढ़ रहे हो, but बाकी subjects तो आपने थोड़े पहले पढ़े, and otherwise वो fear रहता भी है कि what about my subject which I've done 3 months ago or 2 months ago. So would you recommend that some people should be regular in giving grand tests, as regular as you can be?
Yes, ma'am. I believe that practicing individual subject MCQ doesn't help that much than
Yes.
practicing grand test, because the grand test have recent year questions, and
Yes.
they have all the important topics that needs to be covered.
Right.
But if we go in a depth to a particular subject's MCQ, then it's very vast to cover all the subjects.
Yeah.
And also for revising that particular subject MCQ is more tough than revising the grand test.
Yes, and
MCQs.
you might be going into unnecessary details which are not really required as well that
Yes,
way.
ma'am.
राइट. एंड स्मृति, जब आपका कोर्स ख़त्म हो गया TND का, तो अब आपने रिवीजन कैसे प्लान किया?
Ma'am, then I started with the subjects in the September that I can retain more,
Okay.
that needed less revision near the November.
Okay, so you took up the less volatile things first.
Less volatile
Okay,
things
okay.
first, because if I like, for example, I take biochem in the September itself, and if I learn enzymes and pathways, everything, then again in the November I will be landing up with the same situation,
And you have
revising,
to do it again.
do it again, and that the energy was already wasted over that
So
subject.
I think I have to pause her here because today also I was getting these queries that which things should they take up first for NEET for revision, you know. So I totally agree with what she has said. The volatile things, the problem is that you'll anyways have to read close to the exam, at least the most important topics. So you know, you can take up the subjects which are not that volatile and not that factual, and you know, cover them up in the earlier part of the month. And towards the later part of the month, close to the exam, you can take up the more volatile things for you.
Yes,
That is a very nice advice, Smriti. Right. And then during this time of your revision, again, you know, what was your core material for revision? Was it again your notes? And what was the ratio of MCQ and notes that you were doing at this time?
Ma'am, I primarily stick to the notes because the
Okay.
only time I had that to revise those things, and
Right.
Diksha ma'am also keep on updating on the club that
Yeah.
read 10 things 1,000 times rather than doing 1,000 things
Ye-
once.
That's true.
So I primarily stick to the notes, and I used to give GTs and
Okay.
tests at that time more. after
Okay.
completing one of the till August, I
Okay.
used to give GTs more at that time.
राइट अच्छा बहुत बार ना स्मृति जब बच्चे रिविजन कर रहे होते हैं दे आर नॉट एबल टू मेक देयर ओन टाइमलाइन सो डिड यू मेक सच टाइमलाइन फॉर एग्जांपल कुछ डेडलाइंस बनाए थे कि डीबीटी तक कुछ ख़त्म करना है या सीबीटी तक कुछ ख़त्म करना है or
Ma'am,
how did you break let's say from September to or August to November exams?
ma'am, during the end of the August,
Mhm.
the TND subjects were very easy one, like psychiatry, which needed 2-3 days,
Yes, so that's
and
why we keep the schedule like that. Yes.
oncology that needed maybe 1 or 2 days.
Yes.
So the revision itself started in the August.
Wonderful.
Like microbiology is one of the weak subjects and it need repeated readings.
That's true.
So like some subjects need your is strong, then you don't need 2 or 3 readings, you need maybe 2 readings, and for
Right.
some subjects you might read 5 readings.
That's true.
So start with the subjects which you need more readings and focus on that in the earlier part of the year so that
Right.
it becomes strong over the
So that you
end
can, you
of the
have an option of doing it multiple times.
Yes, ma'am. So that the more time is invested in the subject in the earlier part of the year
Okay.
to the subjects you don't know, and in the end you have to revise only those subjects that you know actually very well,
Mm-hmm.
so that when the like micro I had to read many times,
Okay.
but in the end I had read it so many times that
But
it
you
didn't
were-
give me fear of that I haven't done
So
that
this is
subject.
again something to learn, you know. A lot of times we would do the reverse. We would say कि if something is weak, अच्छा बाद में करेंगे और अच्छा इसको और बाद में करेंगे. So if you look at her strategy in the year, you know, the subject that she was weak in, उसने पहले उनको cater किया है so that she can read it multiple times. And close to the exam, she changed her strategy. The volatile things were rather kept towards the exam so that, you know, she's able to read them immediately. And I think this is something very nice to learn from and probably imply in your own reading process as well. So throughout the year, I think that's how it should be. It definitely looks like a winner's plan to me, right? And it has worked for her. That's wonderful. और बच्चे अब मुझे ये बताओ कि close to the exam, because अब एम्स में भी दिया है and you've done fairly well, you've secured 153, which is a very nice rank, right? Looking at the number of candidates that appeared for the exam, right? So close to these November exams, let's say a month before, what were you reading then?
Ma'am, I was reading the subjects which I had marked. I
Okay.
have to read
So
the
that means,
topics I
so
have
you, so now instead of the entire subject, you were doing selected topics.
selective topics I was doing.
Okay.
And for the subjects like that is too vast, I went for the seeing AIMS capsule.
Okay.
For like medicine and all, I cannot keep on revising the whole 4 and 5 notebooks, what notes I
That's
have made.
true.
And so there were 3 to 4 videos for 2 hours. So
Yes.
I used to see that videos, and if there are some topic like see I have not read it or I am forgetting it, so I used to go to the notes and revise it from there.
That's wonderful. So that's how you decided for the bigger subjects. That's great because again, it's too difficult to decide otherwise what to read and what not to read. Okay, and here did you utilize your test and discussion papers as well?
Ma'am, no, I couldn't get that time to utilize that. So
Okay.
During that after tests, I used to add some things to the notes already.
Okay.
So it was already in my notes
Okay.
after that reviewing the test paper.
So you had already concised everything in a single notebook itself.
Yes, ma'am.
Wonderful. And beta, did you give the CBTs?
Yes, ma'am. Since there were 4 CBTs this year, so I gave all the 4 of them.
Right.
And
you know, she's done fairly well. In CBT 3, she secured a rank of 30. And in the recent one, she secured 98. So yes, you were always sort of on the right track itself, right? It was a matter of a plus few questions and a minus few questions. So do you think it is a good simulating exam and a must do before the exams?
yes, ma'am, because during the AIMS paper, I panicked a lot.
Okay.
But in the PGI, I thought that it has to be given like a normal paper. I have given 5 papers till now, so it
Yeah.
should not make such a difference.
Right.
And you get the environment of sitting over there for 3 hours in front of the computer
That's
is
true.
not something very easy. So it was like,
Yeah.
I am giving a regular CBT like exam, think like that, and then give the paper.
Right. And do you think that the quality of these the test papers were good enough to help you prepare for these exams?
Yes, ma'am, because in the test paper there were like 75 to 80 question in all the test papers.
Yes.
So they used to give the important 75 topics. We have to read from the notes, that has to be given more priority
That's
than the
right.
other things we have to read.
That's very nice. So you used it for a graded revision.
Yes, ma'am.
That's great. And you know, a lot of people say that previous year questions is a good material to be done, and we also believe that. What is your take on it?
Ma'am, in the AIMS paper, I couldn't do the previous year paper. So
Okay.
in before PGI, I made sure that I'm at least do one paper to see the. In fact, the PGI pattern is different.
Okay.
So to see what kind of pattern and what do they expect to mark and how many options are actually correct
That's
and how
right.
much are wrong. How you cannot keep on marking in the PGI
Yes,
all the
because
options
the
because
negative marking is quite a lot.
quite a lot.
Yeah.
So I in fact saw the video on that e-medicos that
Okay.
Sandeep sir had given that mark only the options you are sure about it. Do not go for guess questions unless
Yes.
and until you are not sure about it.
Right.
So that your negatives are less.
Yes, because it has a very strong negative marking scheme, right? And did you happen to see the previous year PGI papers on e-medicos with the videos?
Yes, ma'am. Practicing the paper and then reading the explanation, that took a lot of time. So rather than seeing whatever I got the time, even if I was tired after the duty, I can use to manage so see the videos. Even you are not willing to read from the papers and all, then you can just see the videos and something will go into your head. And plus there is a voices going in your head. There are two way of learning there.
Yes. And I think that is something very, very or worth appreciating in her, you know. That's something that she's just said it as a matter of fact, that even if you're tired after a duty, she would listen to a video. So, you know, this shows the determination and the consistency and the desire to make it happen, you know. She didn't think that, okay, I'm doing an internship, so I will not be able to do it, so just leave it. So she's been always trying to do her best, and I think that is something to learn. Definitely, you know, no matter what these circumstances are, even if you're able to spend an hour or two, so consistency will always help. It doesn't really have to be 12 hours at a stretch. Yes, what would you want to say on that? How important is consistency?
Ma'am, I really don't think so after final year exams that I got any time for reading it a 12-hour stretch.
Yes.
And it is not even possible to sit for 12 hours and read. Even it's like if you go and I believe.
And especially by yourself. If you're
By
left by yourself in a room and somebody asks you, okay, read for 12 hours, I think that's
not possible.
It's an impossible task.
Like even like if you do 3 or 4 hour duty, you get a something change in your daily activity.
Right.
And then you come and read. So that is something different you are doing in the day. Two things you are doing different
Yeah.
rather than sitting in a room and reading all the stuff by on yours.
And I think sitting and reading all by yourself doesn't really culminate into effective reading unless you're testing yourself and the environment is where others are also studying and sitting in a group in a class and studying. Yes.
Yes, ma'am. And I will say that during internship, one should keep your eyes and ear open.
Yes.
The patients we see in OPDs, the exposure we get in wards also help in the central institute exams.
That's true. And you know, you are sort of applying whatever knowledge you know. So you're putting your brain into work and you retain those things for a longer time. So wherever you are, the crux is, jahan pe bhi ho, physically ho, that is good. But you should also be mentally present there, whether it is internship or it is a class or whatever you're doing, right? Great. And you know, Smriti, in a month's time, there's going to be NEET exam as well,
Yes,
right? So what do you think should one do in this 1 month before the NEET?
Do not try to read new things.
Yes, very important. Agreed.
And stick to the things you have read in the past 1 year.
Right.
Only revise the things you already know. Just it needs reinforcement. They won't. Giving these 2 papers, I realized they ask only the questions we know. Just we need to apply in that 3 hours.
That's true.
They won't ask. There will be 10 to 15 questions that will be there that you haven't heard of, but those questions are meant to left only in that paper.
They don't make they don't make a difference in anybody's rank.
Just we need to do the correct things what all other are doing correct.
Yes.
Not going for the stuff that I can do that 15 questions right.
That's true, because then what you do is you lose on the other
majority of the paper.
And then it is not nice. So, right, her advice is pretty simple. Stick to what you've been doing so far. Focus on revisions. No new things to be done, right? And that's as simple as it can be. That is great. And Smriti, what branch do you want to pursue, beta?
Ma'am, I want to pursue pediatrics right now.
That's great. So let's hope for the best, and we wish you a very, very bright future ahead, and may you get whatever you desire for. And it
Thank
was
you,
a
ma'am.
pleasure to have you here. Thank you so much for your time.
Thank you so much,
Best
ma'am.
wishes.